Hello. Welcome to the Bogomolets National Medical University, the Department of Propedeutics of Internal Medicine number 2. We begin our online distance learning course. And our subject, the name of it, is Propedeutics of Internal Medicine. It means Introduction to Internal Diseases. The other term may be physical examination or practice of medicine. And at the end of this academic year, you will also have the course of nursing at our department. Let me introduce myself. I am Associate Professor at the Department of Propedeutics of Internal Medicine. My name is Victoria. My second name is Khomazjuk. And here is my email that you can use to ask me questions concerning our study of propedeutics to internal medicine. The topic of today's lecture is the basic methods of patients' examinations, and in more details we will speak about interview, or the synonym to this is anamnesis, and also we will speak about general inspection of the patients. So let's begin. First of all, we need to speak about main terms that we will use in our course. The term symptom refers to what the patient feels. It may be any evidence of disease, such as pain or dizziness or weakness. Another term, sign, refers to what the examiner finds, an objective evidence of the disease. So you use this for some features of the disease that can be checked, such as, or measured, such as blood pressure, fever, or some abnormalities in urine or blood. Oh, wow. Other term is syndrome. Syndrome is a set of symptoms connected with a single pathogenesis. Then we can use the term semiology. This is the science about symptoms and syndromes and their meaning. The term that is known for you is medical deontology, the science of professional ethics. Of course, we use rules of ethics and deontology in our practice in clinic. And the useful term for you is iatrogenic. It may be harm to the patient done by medical personnel. It may be thoughtless or occasional, but even a few words may impair sleep, appetite, or general condition of our patients, so be careful. Well, the next term is diagnosis. This is the process of determining the cause and nature of an illness or problem. At the end of this academic year, I hope that you will be able to make a diagnosis of some conditions by yourself. So we proceed with interview or history or anamnesis. These are the same meanings. Well, so history and physical examination begin and are the heart of the diagnostic and treatment process. We begin with the history. It usually begins your relationship with the patient. You should know some rules for history-taking settings. Yes, look here, there are a lot of rules, and I need to explain this one. It should be removal of physical barriers. For example, you can see here that the student or doctor is interviewing a patient, and there is no physical barriers between them, such as table or chairs or something else. It looks like a friendly conversation. Then, the structure of history or interview. There are 5 main parts of the interview: identifying information, chief complaints, history of present illness, or Latin name is anamnesis morbi. Then goes systems review or anamnesis communis. And the last part is called life history or anamnesis vitae. Chief complaint. This is the brief statement of reason the patient is seeking health care. And according to this part, you can guess, and even at the first appearance of the patient, what system or the organism is affected. Sometimes yes, sometimes not. Next is history of present illness. This is step-by-step evaluation of the circumstances that surround the primary reason for the patient's visit. Why the patients come to you. Next part is systems review. This is detailed review of complaints for each body system. It does not matter if the patient has problems only with one system. It may be, for example, a respiratory system, but you should also ask questions about all other systems to check for some other diseases that may influence the course of the main problem, or they may be important when you will prescribe the treatment. Well, next part is life history or anamnesis vitae. It consists of some parts which are called personal and social history, family history, past medical history, and allergies. So first you begin to ask about personal or social history of the patient. It may be his work habits, relationships at work, school, and home. And then next part of the life history will be family history. And you should ask about family members' health. They may be had some past medical experiences, illnesses, social experiences or deaths, and maybe some genetic diseases in the family. Then you ask about past medical history of your patient. It will be the person's overall health before the present problem, including all past medical hospitalizations or surgical experiences. Oh wow! So here are a lot of useful rules which you should use when you are taking history. So look, the first step when you begin your conversation with the patient is to introduce yourself. Next, you should ask the patient how to address him or her properly, because you should be polite in addressing the patient. Oh, well, then we see that the examiner should be courteous. Very important is eye contact during conversation. Well, you should not overtire the patient, don't be judgmental, be flexible. Well, a very important rule is to avoid medical jargon. You should use the terms that patient understand. Well, one more advice is to avoid a leading question. I hope that you understand what is called leading questions and what is called open-ended questions. So if I ask you what is called open-ended questions, it is open-ended questions because you must give your own answer. But if I ask you, you know what is open? Do you know what is open? You know what are open-ended questions, don't you? So this question will be leading. Or for example, you have some problems with leading questions, don't you? This is also leading question. Oh wow. And of course, when we take the history, we start with general concerns and then move to specific description and clarify the answer of the patient. Oh, wow. During taking history, we can meet with some sensitive issue examples. It may be question about alcohol and drug use, religion, sexual history, and sexual orientation. What should you do in such cases? What should be done when you are approaching sensitive issues? You see a set of rules, but the most important in this is don't push too hard. Okay, because your patient may refuse to answer your questions, and this is his or her right, of course. Well, at the finish of history taking, students should conclude. So what conclusions may be? First of all, what system is affected most? This may be the conclusion from chief complaint part. Then, is the disease acute or chronic? This is the result of the history of present illness. Yeah? Then, what systems, if any, are also affected? This is the conclusion from the systems review. And the last question is about life history. What risk factors of the disease does the patient have? In this case, we need to know what are risk factors. Open-ended question, yeah? Well, so these are such conditions, events of patients or patient special features that may contribute to the disease onset and further progress. On this slide, you can see the examples of risk factors for cardiovascular disease. You see a lot of risk factors such as age, smoking, hypertension, diabetes, and so on may influence the development and progression of the CVD, abbreviation CVD. Wow. And then we shall speak a bit about examination techniques. And at the beginning of physical examination, we should remind standard precautions to prevent infections. And in this list of precautions, we can see that, of course, we should use hand washing, gloves, masks, and sometimes face shield even, and white gowns. These rules which are obligatory for students. So we see the list of main examination techniques. These are inspection, palpation, percussion, and auscultation. Inspection is the process of observation and begins with the first exposure of the patient and continues throughout history and PE, physical examination. So all the time you are communicating with patient, you also observe him or her by vision. Oh, wow. For example, this is the patient with bronchial asthma, and he is sitting in a forced position. Oh, wow. Next technique is palpation. You use hands and fingers to gather information by touch. For example, here the doctor is checking tactile fremitus by palpating the chest of the patient. Next technique is called percussion, and it involves striking one object against another to produce vibrations. So when you use your fingers to tap or strike over in this case, the chest of the patient, you produce some sound waves. They go through the tissue, and you can hear the sound which changes according to the density of the underlying tissue. And the technique which usually is used last is auscultation, and you listen to sounds which are produced by body of a patient. Here you see some guidelines what to do for better auscultation. And of course, for auscultation, you need a special device which is called stethoscope. So, also, during physical examination, you can measure vital signs. What is included into vital signs? It is pulse, respiration, blood pressure, and temperature. So you had some information about these from the previous course of patient care. Oh, wow, this is a recommendation. What do you need to practice in internal medicine? First of all, of course, it's stethoscope. And then it should be sphygma manometer, the device for measuring of blood pressure. Also, it will be useful centimeter ruler, tape measure, and pen light. In some cases, you need to use artificial light to see pulsations or movements of the chest or changes in the pupils. Oh, well, this is stethoscope. We will speak about this at lecture on auscultation. And here you see sphygma manometer, which is used to measure blood pressure. We continue our lecture and speak about general inspection. Wait a moment, please. Okay. Oh, wow. I check if recording proceeds, and we continue with general inspection of the patient. So this is process of observation, yes, by vision, as we said before. And the guidelines for it is adequate lighting, unhurried and careful inspection, and you, of course, you can validate findings with your patient. Oh, what happens? Why it does not work? Oh, well. Sorry, a moment. Well, we try to continue our lecture about inspection. Sorry about delay. So, entire body is first inspected in order to reveal general symptoms. Next, separate parts of the body should be examined: skin, lymph nodes, head, face, neck, trunk, limbs, muscles, bones, and joints. The first step during general inspection is to check the consciousness of the patient. It may be clear or deranged. In clear conscience, the patient should be oriented in time, place, and person, and be able to respond appropriately to questions and environmental stimuli. Depending on the degree of disorder, the following states are differentiated. It may be stupor. The keyword will be delayed reactions and delayed answers. Then it may be sopor. The keywords will be unusually deep sleep, but the patient may recover for short periods of time when called loudly or roused by external stimulus. And coma is the full loss of consciousness, and of course it is the sign of the very hard condition of your patient. Next, you should pay attention to the posture of the patient. It can be active, passive, or forced. I hope that all of you are now in active position and you can change your position as you like. Well, passive posture means that the patient can't move at all according to his desire, and mostly it's observed in unconscious patients. But it may be some other cases of the passive posture. Well, and the most interesting positions for us are forced positions, because such positions are assumed by the patient to relieve or remove pain, cough, or dyspnea. That's why we can use these for diagnosis. Look once more, this is the picture of a patient with bronchial asthma. During bronchial asthma attack, the patient leans against the edge of the table or the chair back with the upper part of the body slightly inclined forward. In such position, respiratory muscles will work more hard and more active and help the patient to breathe out. Well, next, we will pay attention to the skin of our patients, and here we see a picture of a pale face with yellowish tint, which is specific to the Addison-Birmer anemia. Changes on the skin, such as discoloration or white spots on the skin, are called vitiligo. Remind medical term. Then it may be different hemorrhages on the skin, and all of them have specific terms to describe them. For example, here we see very small hemorrhages like dots. The name for them are petechia, and we see petechia so on the skin of the abdomen. Then we can test the skin turgor or elasticity of the skin. We make a fold and then release it, and look how quickly the skin returns to the initial state. And then we can check edema. Here we see edema, pitching edema on the legs of the woman with heart failure Once more, we can see that we press and the pit appears for a few seconds or a minute after your pressing, and then it returns to normal condition. Next, we can pay attention to the fingers of the patient, and here we see enlarged and curved nails, which are called clubbing. Clubbing of the fingers is specific for conditions with chronic hypoxia. It may be in chronic purulent lung diseases, or it may be in congenital heart diseases. Well, this is how to differentiate healthy fingers from clubbing fingers. Also, we can see so-called spoon nails or koilonychia. We can also see a dry skin of this patient because such nails are the sign of the iron deficiency anemia. We can see these so-called stria. This is the connective tissue due to stretching of the skin. When, for example, abdomen is enlarged due to ascites or obesity, so it may appear such stretched skin lines, which are called stria. We also can see enlargement of the vessels. We see distension of the veins around the umbilicus. Such sign is called caput of Medusa sign, according to the Greek myths. Well, it may be calluses on the foot. Then it may be furuncle, as purulent inflammation of the skin. It may be such rash on the skin on the extensor surface of the knee. This is with specific silver tint. It is specific for psoriasis. Then we see rash on the skin due to herpes zoster or shingles. There are a lot of vesicles, but they are confined to one dermatome. Here we see the example of alopecia, the lack of hair in some areas. And this sign is called hirsutism. We see abnormal hair grows on the chin and cheeks of the woman, and it is called hirsutism. In this case, it is idiopathic, but it may be also the result of the endocrine disorders. Next picture, acne in adolescent with a lot of pustula. These elements of rash are called pustula. They contain pus. Next, the disease maybe that you know from your childhood. It is chicken pox with a lot of vesicular lesions. Here we see rubella with papular lesions, and rubella also with macular papular eruptions on the skin. The same eruptions we can see in the throat or on the tongue. Yes, and also you can find the adenopathy inside and on the palate. Yes, we can see the same lesions. Oh, wow. The next step in general inspection will be examination of the lymph nodes. We can palpate some lymph nodes of the head and neck. We can, and the very important rule for palpation is to compare the nodes bilaterally on the both sides. This is palpation of the cervical nodes, yes, of the posterior cervical nodes. And here we see palpation of the supraclavicular nodes. So the main rule in palpation of all lymph nodes is to relax the muscles. That's why the doctor asks a patient to lean forward the neck to relax the muscles. In this case, palpation is easier. Oh wow. One more part of general inspection is inspection of the thyroid gland. In this case, you can see in this woman that she has thyroid enlargement, yeah? And it may be the sign of goiter. And here we see a healthy person, but we see how the thyroid gland may be palpated. The doctor stands behind the sitting patient and palpate, in this case, the right lobe of the thyroid gland. Next phase, very specific. We have different phases in endocrine diseases, and this one is specific for the Cushing's syndrome. And this phase in Cushing's syndrome is moon-shaped. Yes, moon-shaped. And it may be specific for adrenal gland diseases. Next variant of Cushing disease not only changes in the face but also specific obesity with the purplish stria on the abdomen and on the trunk. There is also the photo of the Hippocrates phase, which is specific for the terminal stages of different illnesses. And here we see the face of the patient with myxedema. It will be the myxedema, it is the disease of the thyroid gland with the impaired function. Next variant, this is the face of the patient also with thyroid gland disease, hyperthyroid facies, and we see specific changes of the eyes, which is called exophthalmos. Oh, wow. One more example of thyroid exophthalmos. Yes, we see that the eyes are shifted forward. Yeah. Wow. Butterfly rash in systemic lupus erythematosus. It is on the cheeks. One more butterfly rash, wings on the cheeks, and also the rash on the nose. It looks like butterfly. Oh well, this is left facial palsy. You see asymmetry in the face and nasolabial fold, and the corners of the mouth are not the same. Yes, facial asymmetry, it is the result of injury or disease of facial nerve. Oh, very specific picture, the face of patient with acromegaly. This is the child with Down syndrome. And here is healthy patient, but we are trying to inspect conjunctiva by pulling down the eyelid, and we see that they are white. And on the contrary, we can see in this patient that the conjunctiva are yellowish, and this may be the sign of jaundice. We can also see some accumulation of cholesterol under the skin, and such accumulations are called xanthelasma. different changes of the tongue. Yes, different changes of the tongue specific for different diseases. This one, smooth tongue, is specific for B12 vitamin deficiency anemia. Here you can see how to measure the motion, the range of motion of joints. It will be measured as an angle. Oh, wow. And you check the muscle strength. And also you may examine the joint. Here we see so-called ulnar deviation of joint, which is specific for rheumatoid arthritis. We can speak a lot about general inspection, and we shall continue to do it during our further lectures. But today, this is all that I want to tell you. Thank you for your kind attention. Be safe, and we are looking forward for seeing you at our other lectures.